We are student-assisted medical and dental applications, a society at Barts and the London School of Medicine and Dentistry, but you can call us SAMDA. As a society, we are dedicated to support schools, colleges, and sixth form students in their first step towards a career in medicine or dentistry. We conduct school visits to give you that personal guidance, clinicians' evenings with prestige alumni and professionals, skills days to equip you with all the skills to ace the application, mock interviews with students and clinicians to give you that first-hand experience and get you ahead of the game, a buddy scheme so that we at SAMDA can support you every single step of the way, weekly tips on our social media to give you some bite-sized and concise wisdom and advice. If that's not all, our extensive SAMDA medicine and dentistry guide and much, much more. Check out our social media and stay up to date. We are only a click away.
Hey, Gone, can you hear me? I can't hear you, muted. Lovely. Shall we make a start?
Sure,
Yeah? Hi, guys. Welcome back to SAMDA's Friday Dental Clinic. This is our second last clinic, which is going to be dental diseases associated with systemic diseases. I hope you guys are looking forward to this. So let's get started.
Yeah. So before we begin, the usual, should we introduce ourselves first?
Oh yeah, we forgot that. I think we're so used to it.
I was just thinking that as well.
So hi guys, my name is Manor and I'm a fourth year dental student at and I'm also a dental rep for SAMDA. And with me is...
Hi everyone, my name's Garten and I'm also a fourth year dental student at Barts. I'm also a dental committee at SAMDA. And yeah, so SAMDA, so who are we? So we are a student-run society based at Barts in London, so Queen Mary's School of Medicine and Dentistry. So our society is dedicated to supporting sixth formers that in local state schools that are applying to medicine and dentistry, and we are helping you and other sixth formers to take your first step towards medicine and dentistry.
Yay!
Yeah, safeguarding stuff.
So in terms of safeguarding, we have turned off the YouTube comment section. So if you have any queries or any questions, or if you want to interact with us, you can get in touch with us through our Instagram story, which is at barts_samda. If you also have any concerns, please email us at samda@bartslondon.com and make sure you CC your school teacher in as well. All the information will be held confidential, so don't worry, and we'll be here to help.
Yeah.
Okay, so before we get to the fun stuff, let's get to the more fun stuff. So for the Friday Dental Clinics, we're doing a giveaway, and our giveaway is a dental book, which is called Dentistry in a Nutshell. And this is basically a step-by-step guide or a book that kind of basically puts everything which is practical dentistry into like a nutshell, as it says. And it talks about common procedures, it talks about complex and simple procedures as well. So it's quite handy, especially when you're at dental school. You can use it a lot, or even after you've graduated. So make sure you go onto SAMDA's Instagram, check out the giveaway requirements, and make sure you sign up for the giveaway.
So what we're going to be talking about today is dental diseases that are associated with systemic diseases and like the link between them. So yeah.
So in terms of what we will talk about today, first of all, we'll talk a bit about infective endocarditis. If you guys don't know what that is, it's fine, don't worry. And then we'll talk about diabetes, and also then we'll focus on mental health and how all of these three different conditions link to our oral health and also dentistry. And after that, we've got a fun quiz for you guys. So hopefully you guys will enjoy that as well. But just a small reminder, if you don't understand anything or you feel like it's a lot, just don't worry. Enjoy as much as you can. You guys will not be tested on this. You guys don't need to know any of this right now. It's more of an insight and about how dentistry links into the whole body. So just, learn what you can, enjoy it at the most.
Just enjoy it.
Yeah, just enjoy it.
You guys aren't expected to know all of this and stuff. And I personally, I never knew anything about this when I was applying. So no pressure.
You guys not need to know anything, honestly, for now. So let's get started. So infective endocarditis. Just to break it down for you guys quickly, infective, as you know, is to do with it's an infection which is caused by a microorganism, for example, a bacteria. Endo means within. Card usually refers to the heart, and itis usually refers to inflammation. So from the name itself, we can tell that it's the inflammation of the heart, the inner part of the heart, which is caused by an infection or a microorganism, okay? We'll talk a bit more about this, but I wanted to explain the name itself to you and why it's named that. So infective endocarditis, also referred as IE, is a rare but life-threatening infection of the endocardium, and it particularly affects the heart valves. Endocardium is basically the inner lining of the heart, which kind of explains the name as well. It is it's most common in older men, and with half of all cases developing in people over the age of 50. The infection is usually caused by bacteria, and this bacteria may come from the mouth, it may come from the skin, it may come from the respiratory system and other parts of the body. The initial symptoms of this is very similar to flu and include things like a high temperature, headache, chills, as well as joint and muscle pains and much more.
Yeah.
Now, why does it link into dentistry? Well, if you remember from a previous slide, I did say that bacteria can come from the mouth. So to explain this further, in rare cases, it's not that common, but in rare cases, bacteria in the mouth can trigger this, especially people who are at higher risk. I will talk about who these people particularly are on the next slide. But what can happen is that sometimes bacteria, so dental plaque is basically, it basically accumulates around the mouth, and bacteria can be a part of this. And if we don't brush our teeth properly, for example, this bacteria is not removed properly. And if it's, for example, someone doesn't look after their mouth or have got bad oral hygiene, slowly that bacteria can build up, and that can lead to things like gingivitis, where the gums may become inflamed, red or swollen. They may also bleed when you brush your teeth, when you floss, or when you go to a dentist and they do certain dental procedures, such as, an extraction or something else that causes bleeding. So what happens, for example, in this case, if your gums bleed, this bacteria can go into the bloodstream. It can travel through the bloodstream into different parts of the body and cause infection. One part of the body can travel to is the heart. And in the heart, what it can do is it can affect the inner lining of the heart and also the surface of the heart valves. And it can stick to it, it grows, and it kind of blocks it and disrupts the function of the heart and reduces its efficiency. Yeah. So that's exactly what it does and how it spreads. Now, in terms of people who are high risk, people at high risk are those who have artificial heart valves or any type of heart condition, people who have congenital heart diseases, or for example, any heart condition they're born with, anyone who has damaged heart valves, or anything else that puts them at high risk of infective endocarditis. And if they don't receive any treatment, or if it's undetected, then what can happen is that this infection can continue to grow and over time damage the heart valves and disrupt the normal flow of blood throughout the heart. This can trigger a range of different things, and because it's affecting the heart, what can happen is that it can affect the blood supply to the brain and can cause stroke and and reduce the quality of how efficiently the heart works and can lead into things like heart failure. Now, I'm going to pause on this slide for a moment. I know that's been a lot of information overload, but the main thing I would like to summarize is that infective endocarditis is basically how when someone doesn't look after their mouth, for example, and bacteria builds up, this bacteria can go into the blood and can infect different parts of the body. It is quite rare, but then that infection can grow and lead to things like infective endocarditis. Okay, so that's like the main summary and the main link we're making between oral bacteria and then it going to the heart and, leading to this, which can cause death eventually.
Yeah.
So,
I'll move on.
Yeah, so to the next slide. This is more about management. Don't worry about this. There's a table on this. Honestly, this is just for context. You guys don't need to understand a word on this. But the main thing I want to point out is when you have a patient, the one thing you want to look at is like, what's their risk level? Are they at high risk, low risk, or medium risk? And then according to their risk, there's usually two types of management for patients. There's a non-routine management, which is for almost every patient, and there's a routine management, which is only for patients who are at increased risk of infective endocarditis, particularly those who are in subgroup requiring special consideration. So the right table, you can say. So people who've got like particular heart conditions or people who may previously have had an infective endocarditis infection. So you guys don't need to know about this. Just know that there are different types of risk groups and people will be treated according to that. That's all you guys need to know. So just briefly to run through what routine and non-routine management is. In routine management, what you want to do is that you want to inform the patient of all the risks of the treatment they'll be getting and how, if any bleeding is caused, what that can potentially lead to, and that infective endocarditis is a risk. And you advise them on how to prevent this. You talk about why they can't get antibiotic prophylaxis as well. It's actually maybe before 2008, antibiotic prophylaxis was a very common treatment. Anyone who was at any risk of infective endocarditis was offered this. But over time, research found that the evidence for its, efficacy or sufficiency has been quite low. One can't tell if giving antibiotics before to prevent infective endocarditis often doesn't really make any difference. So it's been ruled out now that from now onwards, people who are at very high risk and actually will benefit from getting antibiotic prophylaxis are actually the only ones who get this. So at the moment, routine management is just to make sure the patient is aware of what's going to happen. They know if they have this, how they can prevent it, and make sure like patients understand the importance of looking after their oral health. For example, they need to brush their teeth twice a day. Also, it's also important that you make your notes, you record everything you've discussed with the patient, all the options you've given them, and as well as the patient's response and what they want to do. Now, routine management is all of that, including you working with maybe, for example, the cardiologist or someone who they're actually being seen by. So it's called a multidisciplinary care.
Yeah.
And guys, it's a long word. And so in that one, the main thing is you're working with a specialist in regards to what treatment would be the best for this patient, and you're also giving them antibiotics before you do any treatment, just to reduce their risk of getting infective endocarditis because they have a high risk. So I know these slides have been a lot, but I've summarized the previous slides to you. And in this slide, the main thing is risk first, find out the risk, then you manage the patient depending on what that is. That's it. So don't worry about all the other words. So let's move into the next thing now.
Yeah, so the next topic is on diabetes. So let's begin with the definition of diabetes. I'm sure some of you are quite aware of this disease. It's quite common as well. So diabetes is a health condition where the body has difficulties turning food into energy. So there are two types of diabetes, which is type 1 and type 2. I'll just go through that. So type 1 is when the body actually fails to produce insulin. So people with type 1 diabetes are usually born with it, or it starts at a young age. Because they can't produce insulin, it needs to be replaced by injecting insulin into the body from using syringes that they carry and stuff. So that's type 1. So type 1 is insulin is not produced by the body. And type 2 is similar but a bit different way. So the body actually do produce insulin like any other people, but the produced insulin is no longer as effective at the cellular level. So for example, let's use a key as an analogy. So the key, which is the insulin, becomes a bit rusty and you can't really use it to actually unlock the cell doors to allow the blood glucose to enter the body. So if that makes sense. So yeah, so the body has the insulin, but it just can't, it doesn't work that well. And this, it doesn't start at children, it usually starts during adulthood. And usually the initial management is through changing the lifestyle. So yeah. So how does diabetes got anything to do with dentistry, you know? So if diabetes is not under control, the patient is more likely to develop dental problems. And the most significant problem is the gum disease. The gum disease is usually due to the prolonged high blood glucose level in the blood. So, yeah. So gum disease. So these are really icky photos from the internet that shows different stages of gum disease. So gum disease is also known as periodontitis. It's actually classified on the severity of its development. So there are 3 stages of gum disease. So the first one here, this one, is gingivitis. And gingivitis is a initial stage of gum disease caused by poor oral health hygiene and irregular plaque removal from teeth. So, as you can see in the photo, it's characterized by swollen, red, tender gums, and it can actually cause bleeding when you brush your teeth. So, but what's okay about gingivitis is that gingivitis is actually reversible. So if you go back to your good oral hygiene habits and you go back to your dentist and hygienist, get some advice, get your teeth cleaned, you should be able to reverse this process and get, become just better with the oral hygiene. It should reverse.
And
However,
good day comes.
yeah, sorry. But if you neglect your bleeding gums and you're just like, it's fine, it'll just go away with time and don't really change anything about your oral hygiene habits, it leads to a mild periodontitis. This looks yuckier than the gingivitis, as you can see. The conversion from gingivitis to periodontitis is more common in patients that have uncontrolled diabetes. So at this stage, there will be like damage to the gums and also the bones that are supporting the teeth. So in order to prevent further damage, you really need to go to the dentist and get some periodontic treatment. But if you don't, and it gets worse, it becomes a severe periodontitis. This is the most advanced stage of gum disease, as you can see in the photo. All the gums has set down, it's like all receded, and you can actually see a bit of like roots of the tooth as well. It's characterized by significant tissue and bone loss around the teeth. And unfortunately, if you get periodontitis, it's not reversible, so it's irreversible. And this is due to the gums. Once they are damaged and sinks, they actually cannot grow back. So that's why it's irreversible. So before you hit the stage, we need to really educate the patients to, brush their teeth very well and get a periodontic treatment beforehand. So treatment and management. As mentioned before, increase in blood sugar level can actually increase the risk of gum disease, but at the same time, it works in the other way as well. So periodontitis can actually disturb the control of blood sugar level, which is really bad because it's just a whole cycle. Like one affects like A affects B and then B affects A. Just not that great. So that's why treatment of and it shows that treatment of periodontitis in people with diabetes have been shown to to result in improved blood glucose level control. So because it's been it's been shown that it's clinically relevant. So two diseases are clinically relevant. I can't talk today. So the dental team has an important role in the managing patients with diabetes. So how do this work? So before, when we see a patient, we really need to do a thorough history check. So unless the patient tell us that they have diabetes, we have to ask them, like, do you have diabetes? Like, what type it is? Do you take any medication for that? And just like on and on, just to get the whole idea of what how is diabetes controlled by the patient. And after that, every visit really need to do a thorough periodontal check. So check on every time they come. And we really need to inform the patient about the link between these two diseases, and we need to work towards work with the other health professionals, so like the GP, in order to really improve the patient's diabetes and gum disease. So yeah, that's it for the gingivitis and diabetes and everything. Moving on to mental health.
Well,
Okay.
I think shall we give them a minute, because I feel like that
Yeah,
was.
I was thinking the same thing. I was like, okay, I feel like we should take a little bit of break before we just move on to the next topic. So, how should we do
Guys,
this?
I know that was a lot, but like honestly, just try and think of the basic stuff. The main importance. I can't speak as well today. The main importance of this session today is just to let you guys know that dentistry actually has a big hand into general health, and it does actually influence. I can't speak. It actually influences us in many different ways.
Yeah.
Like I was talking about the bacteria in the mouth and how that can travel to the heart and cause something like heart failure. And then Garnt spoke about the fact that, you know what, you can have diabetes, but if you don't actually look after your diabetes and it's not controlled, you can actually have bad gum health. And if you neglect that, then you can actually start getting bone loss, which is periodontitis, and it's irreversible, which means you actually start losing your teeth.
Yeah.
So that's the main thing we're trying to get out here for you guys today, that
Yeah.
if you know the oral health, if people neglect that, it's important that people understand that they need to look after, because when it's neglected, it actually doesn't help the general health as well. It actually makes things worse for people. And the next thing we'll shortly speak about is mental health. So we'll give you guys a few more seconds. Enjoy it. It's the last one. We're nearly done, we promise.
This is the last one. So, but yeah. It's crazy to see how dentistry is not just about teeth. It's honestly, it links to everything in the body as well, and it's really common for people to just think, oh, like I'll care about my, it's just like people neglect oral health as well, compared to other systemic diseases. So yes,
It doesn't seem as alarming, isn't it? But you can call it like a silent condition, a silent disease that slowly gets to one person in a different way. And it's another thing. You guys are obviously looking into applying for dentistry, and one thing that I always had people say when I was applying for dentistry was things like, "Oh, dentistry is so boring. All you do is look inside people's mouth all day." But honestly, like when I was doing my work experiences, and even now when we study, it really surprises me how bacteria in the mouth can do things like this, or like you not looking after something like diabetes can actually affect your gums. Like the link is actually, and there's a lot more things which obviously are still in being studied. There's still evidence that's been gathered for them, but there are different things that actually does link. Either the oral health affects your physical health, or the physical health affects your oral health. So it's quite like there's a lot to learn and a lot to do. It's not boring, in my opinion.
Yeah, I think I think before I applied to dentistry and like in first year, I just kind of thought, oh, we're just gonna be seeing teeth all day and stuff. But like thinking about it now, it's really not. Like I think we see patient as a whole as well, like not just medical history as well. We check their social history, their family history, and just like, yeah, it's like having a sneak peek at someone's life and just like, how you doing? You know, it's like, it's not just about teeth, honestly. I never see it as just the teeth anymore, you know, it's crazy.
Yeah.
It's crazy
I think
what
we're good
dentists
to go.
do to you.
Actually. Okay, whenever you're ready, I think we're good to go.
Okay, let's move on to mental health. So, mental health. Your mental health affects the health, as you know, I'm sure you guys all know, but mental health affects the health of your whole body, including oral health. So, people who have mental health problems are more likely to have oral health conditions, so like teeth, not just the teeth, but also gums as well, like we mentioned before. But so, good oral health needs to be can also affect mental health at the same time. So it's like a very two things, like mental health affects oral health affects mental health. It's very, the link is just unreal, you know? So these are the common mental illnesses that can actually affect a person's oral health negatively. So we have like anxiety, so like dental phobia as well, depression, eating disorders, schizophrenia, and loads more. But we'll only focus on some bits that are more associated with dentistry. So, anxiety. Many people suffer from form of dental phobia. I mean, I'm personally kind of that person. I actually hated going to the dentist when I was young. So because you're scared to go to a dentist and you're very anxious, you just don't want to go. You stop going to the dentist regularly. And what does this mean? So if you don't go to a dentist, if you don't go to your dentist frequently, you'll just neglect your oral hygiene, and you won't. This would really have a severe impact on your oral health. So that's one of the dental association of anxiety. And the next one is eating disorders. So those who suffer from conditions like bulimia actually often experience dental erosion from the acid in the vomit. So when you vomit, because the vomit is acidic, when you vomit it out, it actually causes erosion of your teeth. And in patients with eating disorders, it's likely for their calcium level to be quite low, which also kind of affects the health of your teeth as well. And medication wise, some medications used to treat or like manage depression, so like antidepressant drugs, can actually have side effects such as dry mouth. And what's crucial about dry mouth is that it actually increases your risk for caries, which is dental decay, and also gum disease. So this whole thing is kind of like everything's kind of linked as well. Not just the medications to treat mental illnesses, but a lot of medicines actually cause dry mouth in patients. So you need to really see what kind of drugs that patients take as well. And next is low energy. Depression or other mental illnesses can make you feel really tired and unmotivated. So you may so patients who are suffering from these kind of diseases find it difficult to perform basic tasks like brushing teeth and flossing your teeth. So it's that's why it leads to the whole like poor oral hygiene habits. As well as that, if people are too tired and unmotivated to prepare meals, it actually leads to poor nutrition as well.
Also, sorry, can I add something?
Yeah.
I was just going to say that in terms of eating disorders, bulimia, the thing about the link between it and vomiting is that people who have this eating disorder tend to like eat a lot in a short time. So they actually end up vomiting. They feel sick often. And obviously when you vomit up the acid in your stomach, and that's where the acid comes up to your mouth, and it causes erosion to teeth over time. So that's the exact link between the eating disorder.
And usually the dental erosion is on the inner surface of the mouth because it's coming from inside instead of the outer surface, if that makes sense. Like the labial and buccal surface is more like palatal and lingual surface.
And those who are here for the last few sessions know which are the palatal surfaces and which are your buccal surfaces.
All
So
these
you know who
surfaces.
you are.
All these surfaces, you know, it's fun. So how do we manage this? It's important for the carers and the patients to be aware of this link between oral health and mental health. And people who are suffering from mental health, we really need to motivate them in a really nice way and in a polite way to maintain a good dental habits, and encourage them a healthier lifestyle. So like eating balanced meal and doing regular exercise. And the most important thing is really like support thing. So like, but you telling these patients these kind of stuff, I'm sure they also know it themselves as well. They know how important brushing is. They know how important to do like exercise every day, but there's no point of you being like, why aren't you doing this? You should really spend your time brushing your teeth. Like that's just gonna patronize them and then make them feel bad about themselves instead of motivating them, if that makes sense. So yeah, it's all about support. And I've on the right hand side, I've also written some oral hygiene advice that you could give to the patients. So it's the usual stuff, brush your teeth twice a day for 2 minutes using fluoride toothpaste, clean between your teeth using floss or interdental brushes, stop smoking, reduce alcohol intake or just stop drinking, cut back on the sugary food and drinks, see your dentist regularly, and eat a healthy and balanced diet. Yeah, balanced diet. So yeah, that's all on mental health. And it's time for a quiz.
Well done for listening, guys.
That was a lot. I'm sorry.
I hope you guys, enjoyed it as much as you can, and just realize that, the impact dental conditions have is quite big on the body.
Yeah.
So that's the main thing here today. We've got a fun quiz for you guys. Good luck. Gaan's gonna bring up the pin, right? So just put
I am gonna do that.
Yeah, just follow the Kahoot link.
Okay. Let's see how I do. Okay, I'm gonna stop screen now and then share again. Share screen. I'm not too sure if this. Okay. Did that work?
Nope. I can hear it, but no.
No, I think. Can the graph? Can you share the? Can you? It's like it's there. Yeah, that's it. Okay. Oh, I think I need to make it bigger. Can you see it now? Is that like quite big?
Yeah, I can see it. Guys, just put in the game pin.
So the game, go to www.kahoot.it and then write the game pin, and then we'll do some fun quizzes. Honestly, because you can make up any nicknames, it's gonna be quite anonymous and it's fine. Just feel free to. I love seeing the nicknames so much. It's just so. It's my favorite part.
I remember XD from last time. Cheers.
Is that the same person?
Yeah, it might be,
Oh my god.
Oh, they're so cute. Look at the smiley faces. Marvel, Maria, KR. Hi, guys. You guys are too cute, man.
So the game pin is 9638309. So
Oh, you guys! Oh my god, you guys are so cute.
Oh, look at all these smiley faces.
You guys are literally making us smile so much right now. Thank you.
Should we just wait just a bit more and
Me.
then?
Yeah, let's give it, I think, about 2-3 more minutes because I think some
Yeah.
people might be logging in. Oh my God, I love the emojis. Look at them. There's like a
It's
tongue
also
out.
the trends.
It's so cute.
So yeah.
Shall we give it 1 more minute?
Yeah. Okay.
Just in case someone wants to join. Yeah, see, there we go. We've got 1 more person in. I think, guys, even if we start and some of you are still joining, you can still join. It won't stop you.
I'm just thinking, this is the right one to share, right?
What do you mean?
I don't know. I'm just like, because I've never actually shared Kahoot before, so.
Did
You
you
know,
choose the right quiz?
I think so, yeah. I
It
already
should
have
be-
one quiz.
That's
If
fine,
it'll
then
be the
that's
right
the one. It's the right one. I think
Okay.
you should be good to start now if you're ready.
Should we start going? Okay.
Yes, let's do it.
Just one last
Oh,
one.
lovely.
Okay, we'll start now. It has at home. Did yours have at home? Because mine, okay. Anyway, dental diseases. Okay. Oh, no, I thought that was the,
That was nice.
I thought that was the question.
Nice. Cool. Go on. How long do they have to answer?
30 seconds.
Lovely. You guys have 30 seconds. The first question is, every patient with a high risk of infective endocarditis is given antibiotic prophylaxis before any procedure they have. Is this true or is this false?
Before any dental procedure. Sorry, the SAMDA logo is kind of hiding
Yeah.
it, but it says. So, yeah.
We need 2 more answers and then we've got 5 seconds left. Guys, make a guess if you're not sure.
Oh,
Right.
my
The
God.
answer is false. It's, if you guys can remember back to what I was saying, after 2008, it's only for those who are at high risk, particularly those from that special subgroup.
Mm.
So yeah, it's not everyone.
So, not for any dental procedures as well. So, yeah.
Yeah.
Next. Oh, that was really quick. Wow.
Yeah, that must
They're
have been.
very tight. Oh my God, 2 people have the same one as well. So, okay, next. Why are some of the initial symptoms for infective endocarditis mentioned during this?
So what are the initial symptoms that were mentioned on the first slide? Is it A, headaches, muscle and joint aches and chills? Is it B, high temperature, nausea and migraines? Is it C, tension headaches, muscle pain or stomach cramps? Or is it D, headaches, high temperature or diarrhea? What do you guys think?
Can you guys don't have problem reading these things, right? I'm just worried.
I think it's fine because we've got 18 answers.
Ooh.
Yeah, it's fine. So, guys, yes, it's actually headaches. It's not nausea. It's not migraines. It's not tension headaches. It's just headaches. And it's not diarrhea. So that rules out all the other 3 options, leaving the first one.
Yeah. Next question. Let's see the board. Oh, it changed a lot.
Oh, wow. Big change.
Let's see. Next one.
Infective endocarditis is most commonly caused by, is it fungi, viruses, archaea, or bacteria? Lovely. We've got 15 seconds left. Waiting for 2 more responses. 1 more response. Lovely.
Wow.
So it's bacteria most commonly. It can be caused by all of these, but most commonly it's caused by bacteria and then viruses.
Yeah. Ooh, KL has the highest answer streak of 3. Impressive.
Infective endocarditis can lead to death. Is that true or false?
It's such an emphasis. Bleed to death. True or false?
Waiting for 3 more answers, 2 more answers, and 2 seconds left. 1 more answer. It's true, it can. If you guys think back to what I was saying, if it's not treated, it can lead to heart failure, can lead to stroke, and all of these things are main cardiac conditions that lead to death.
Yes.
So well done, guys. SB, KR, and all of you are answering them.
Next quiz.
Why is antibiotic prophylaxis no longer routinely recommended? A, it's expensive. B, people don't finish their course, antibiotic course. 3, there is insufficient evidence for its efficacy and how efficient it is. Or D, you guys don't know. We're not sure why that is. Nine seconds left. 5. Oh. So that is, yeah, that's the most common one. There's not enough evidence for this.
Yeah.
And it's always about benefits and risks. In this case, because there's not enough evidence, these drugs actually do have adverse reactions. So the best thing to do is you always see, is it worth giving this antibiotic to someone? If they're at low risk or high risk, but not that high of a risk, then you just don't give it to them.
True. Next. Oh, that's how it changes.
Yes, we're still at the top.
Wait. So diabetes is a condition where the body produces too much insulin. Is that true or false? So yeah. Ta-dum. Yes. So diabetes is a condition where the body actually either fails to produce insulin or the insulin produced is just doesn't really work. But it's not about producing too much insulin. So well done. Ooh, this I find this so funny. Marvel is the highest climber. Yay! So having prolonged high blood glucose level. 1 increases the risk of gum disease, or B decreases the risk of gum disease, or C it doesn't make much difference in the risk of gum disease. Ta-da. Yes, everyone got it right. Amazing. Let's see. Oh yeah. Okay.
KR. Oh.
Next one is, which classification of gum disease is this? Sorry, the photo is a little bit small, but is this gingivitis? Is this mild periodontitis? Oh yeah, that's great. Thank you. Or is it severe periodontitis?
Your clue here is the bone is going down because you can see the roots.
These, if you see here, this is where the gum should be. Yes. So it's a severe periodontitis. Show media. Can I show them? Oh yeah, here. So you can see how the gum has receded, so it's kind of sunk down, and then you can only see the bone loss through radiographs, but visually, like clinically, you can see how the gums have been damaged, so it goes down, and it's quite severe. Next is cutie patootie. Next. So find 1 correct feature of gingivitis.
Is it irreversible? Is it reversible? Have a pick. Does it lead to gum recession? Does it lead to bone loss? Have a think.
So we talked about the different stages of development of gum disease, and yeah, think about which stage gingivitis is and the features of it. Yes. So the correct feature of gingivitis is it's reversible. So if you actually adapt to the correct and correct oral hygiene habits, like brushing your teeth properly and removing plaque, well, then it should be reversed. But yeah, gum recession only happens for periodontitis. Usually for gingivitis, it's when the gum is like inflamed and it causes bleeding, but it doesn't cause any recession. That is periodontitis. All the other ones are periodontitis. So yeah, next. Tight.
We've got 4 questions left now. Best of luck, guys.
How often do you do periodontal screening on diabetic patients? Do you do it every 2 months, every 6 months, every 12 months, or every visit? Yes, we do it every visit. I mean, it really depends. Okay, this was kind of like a trick question because it really depends on the patients, like how often they are meant to go back to the dentist. But regardless of like month wise, it should be done every visit. So yeah. Oh, that changed a lot actually. Oh my god, this hello me just hit the answer streak of 9. That's really good. Which side effect can antidepressant cause? So
Black hairy tongue.
Love black hairy tongue.
I think that's actually a condition, isn't it?
Yeah, it is, and it's don't
Why
look
is
it
it
up.
in?
Don't look it up on Google. Don't just don't. Yeah. Dry mouth. We mentioned about dry mouth being a side effect of antidepressant. Not just antidepressant, a lot of medications actually cause dry mouth as a side effect. And what does this cause dry mouth? It actually increases the risk of caries as well as the gum disease. Oh,
2 more questions to go.
2 more questions.
You guys are doing amazing, honestly.
Yeah, you guys are doing really well. So bulimic patients often experience dental attrition. Just saying what is dental attrition is like, it looks like this.
It's basically when you grind your teeth a lot.
I think that was a big hint from Manor. So
Is that true? Do they grind their teeth a lot? I don't know. I can't remember.
it's actually false. Bulimic patients, as we mentioned, bulimia is when you, as Manor mentioned before, is when you have eating disorder. So like you eat a lot at once and then you actually feel bad, so you kind of vomit it all out, and that causes dental erosion, which is a little bit different to attrition. Erosion is when the teeth enamel is damaged from the acid or like acidic solution or like vomit, as in bulimic patients. But dental attrition is a little bit different. It's when you, as Manor said, it's when you grind your teeth a lot, or like when you grind your teeth in sleep. So it's called bruxism. But bulimic patients don't really have, there's no much like a link between bulimia and dental attrition or dental erosion.
So guys, the only thing I'd like to point out, Gahan, is that dental attrition and dental erosion are actually tooth wear. So in both cases, tooth tissue is lost. But the way it's lost is different. Dental attrition, as I said, is lost by when you grind the teeth. But dental erosion is by acid.
Yeah.
So yeah, if you look at the picture, you can see how the teeth have become smaller, and that's because of the fact that they've been rubbing against each other, and they've been moving against each other with so much force that they become smaller and smaller, and they lost their biting surfaces.
Mm-hmm.
but that doesn't happen with patients who've had
Weird.
acidic erosion, which is due to vomiting in such case of bulimic patients.
Yeah. I think this is the last question now. So what is the wrong management for patients with mental illness?
Do you prescribe?
As a dentist saying.
Yeah. So as a dentist, would you want to give them a fluoride toothpaste so they can look after their teeth?
No, this is a wrong management. So 3 of them is correct.
Yeah.
1 is wrong. So choose the wrong one.
Which is wrong? Would you want to give them healthy eating?
Yes.
Eating. Okay, well, there we go. I was
here, this was kind of tricky because as a dentist, we can't actually prescribe antidepressants. Only the GPs can do that, or like any specialist. But as a dentist, we can prescribe fluoride toothpaste because for caries prevention, but we actually can't prescribe antidepressants. So we would have to work with the GPs like collaboratively to give the patient the best care. So yeah, that's it. Let's see who are the winners.
Third stage. We've got at third place is T. Second place is
my.
At first place is cheese.
Oh, you guys! That is crazy. 12 out of 13. That is crazy. That is really good. But everyone, as we mentioned, don't be disappointed if you didn't get many questions right, because this is really like a taster session. Like, what is it like? What do we learn when you go into dentistry? It's like that kind of stuff. So don't be pressured to know all of this and so on.
Yeah. So back to the presentation, just to round things off.
This technical stuff. Okay, we're back. So thank you everyone for listening and joining all the quiz. It was really fun.
Yeah, thank you guys. We've got just 2 more announcements for you guys. The first one is feedback. So go on.
Oh, should I go? Okay, so your feedback, it would be amazing if you could just scan the code here, or you could, if it doesn't work, you could actually write down the little thing, the link, the link, to give us a little short feedback. It's gonna take you less than 1 minute, and it would be wonderful if you could give us a little feedback. Everything's anonymous, so be as honest as you can. Just, you can roast us, or you can give us like really good feedback.
Also, I need to do a quick announcement just to remind you guys about the giveaway. Please take part in the giveaway. It is a very good book. I actually had to buy it myself, and it's like close to £50. Yeah, and you guys are having the chance of winning it yourself for free. So like, sign up for this. You guys have probably, I think the requirement for this is being able to attend, I think 2 sessions at least out of the 5 sessions we have. So if this is the first session today, then you've also got the chance to attend the second session on Friday, next Friday. So join in. Sign up for the giveaway, and maybe you might win this amazing book, which is quite useful, especially when you've started dentistry. So good luck for those who have already joined the giveaway, and good luck to those who are going to join it. So yeah, thank you for listening to me and Garten do the last few talks. It's been really good. And Ravan, which I think some of you have already met, will be doing the last Friday dental clinics. So yeah. Thank you for your time. And if you guys have any questions, you know where to get in touch with us, or on what to get in touch with us.
Yeah, that's
right. Yeah. So yeah, I think we're good to go now.
Yeah, thank you so much.
Bye guys. Have a good day.
Your application and just everything in your life.
And if you have any questions, just drop a message on SAMDA's Instagram or anything else. Have a lovely weekend. Bye.
Bye.